Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you, and let me be crystal clear to leave an everlasting impact upon you. Just imagine being buried alive. You're in a coffin, but you know you're not dead. You don't know how to get out of this coffin. You try lifting the lid, but the enormous weight upon the lid prevents you from opening the lid. You then try banging on the lid to unsettle the dirt. Maybe somebody will start digging their way down towards you. This is what it's like to feel at the lowest point of alcohol and drug addiction. You know you need help, you know you can't do it on your own, but you don't know where to turn. In reality, there are probably people standing by your grave. You just don't know that. You just think you're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, my audience, did it ever cross your mind while you were abusing drugs and alcohol that maybe, just maybe, you might overdose and take something away that God had given you called life? More selfishly, you'll take your life away from your mother, your father, your brother, your sister, husband, wife, even children and grandchildren. With this, let me leave one last thought. Don't be like the person that went to their grave and didn't get help. Instead, pick up the phone and call me at 844-405-HELP, and I promise you I'll help you take your life back before your life is gone. Folks, people like Larry Geis with over 30 years experience as an addiction and life coach, 516-458-2741 or www.odysseyconsultant.org. Larry Geis and I always tell people like you, it doesn't matter where you came from, it doesn't matter where you've been. What matters is that you're here today for a better tomorrow. Folks, give him a call at 516-458-2741. Larry Geis from the Geis Academy will help you from your addiction to your recovery, from depression to happier times, from low self-esteem to raising that self-esteem. Go to www.odysseyconsultant.org or call Larry at 516-458-2741. Tell Larry Ralph sent you from the Take Your Life Back Today show. When you take your slippers off at night, don't just put them by the edge of your bed. Stick them way under your bed, arm's length. In the morning when you wake up and you get to see beautiful waterfalls and streams because God gave you another day on this beautiful earth, you'll have to get those slippers because you don't want to walk on that cold floor. So you're going to drop to your knees to look for those slippers. There they are. Go and grab them. While you're on your knees, utilize what I call knee-mail, K-N-E-E mail. Knee-mail is your personal chat line between you and God each and every day. When you're on your knees, you ask God for guidance, direction, forgiveness, and mercy. You thank Him for your home, your clothing, your food, your health, your family. You ask God to protect each and every person that you care about, to protect the world, to give people a reason to smile. This is your communication line between you and God. The power of prayer is stronger than any president or king in the world. And if you do this consistently and constantly, every single day, eventually you'll see changes in your life. But you have to mean whatever you say from the heart, and there is no script for it. Just say what's on your mind from your lips to God's ears. The power of prayer will work. Suffolk County, New York, is where I live in the Hamptons, and Suffolk County leads in heroin overdose deaths. Statistics were released recently that confirmed what so many people and devastated families already know to be heartbreaking true. Suffolk County, New York leads the state in heroin-related overdose deaths by a wide margin. Between 2009 and 2013, 337 heroin-related deaths were reported in Suffolk County alone. The New York State Opiate Poisoning Overdose and Prevention Report prepared for Governor Andrew Cuomo and the New York State Legislature was unveiled last week. The report provides an overview of opiate-related mortality and morbidity and other consequences of heroin prescription opiate misuses across the state over the last 5 years, the document states. The New York State Assembly, Andrew Ayera, ranking member of the Health Committee, was joined by Suffolk County Legislator William Doc Spencer, chairman of Health Committee, and heroin substance abuse experts at a press conference on Sunday in Hauppauge, Long Island, New York, to discuss this data. The report indicates that 337 people died from heroin overdoses in Suffolk County during the 5-year period, more than in Bronx, which recorded slightly over 200 such deaths, the second highest in the same period. There were 128 heroin-related deaths in Nassau County, Long Island, New York. The report also indicates Suffolk County, New York, is plagued by cheap heroin coming into the United States. Lawmakers said with hospitals and outpatient treatment facilities swamped by the ever-escalating number of cases and Narcan saves rising dramatically. Ryer said that Pilgrim State Psychiatric Center in Brentwood is underutilized, and he urged the state officials to open up the beds at this facility for inpatient treatment for heroin addicts, according to the PICS 11 report. This is an emergency. This is a major crisis, Ryer reportedly said. We need to open up those beds as quickly as possible. According to the report, opiate-related emergency department visits increased 73 whopping % from 2010 to 2014. The number of heroin-related deaths increased in 2013 to 637, and the opiate anxiolytics-related deaths rose to 952, increases of 163%, 30% from 2009, respectively, the report states. In 2013, an average of 2 New Yorkers a day died of heroin-related overdoses. 2 New Yorkers. More than 4 times as many men died of one of these overdoses compared to women. Whites died of heroin-related overdose at a rate of nearly twice that of blacks, and almost 1.35 times that of Hispanics. The upward trend in heroin-related overdose fatalities among younger New Yorkers is particularly alarming, the report states. Half the people who died were under the age of 35. Numbers are not surprising, are they? These numbers are absolutely devastating, but shouldn't be a surprise to anyone, said Dr. Jeffrey Reynolds, President and Chief Executive Officer at the Family Children's Association in Mineola, Long Island, New York. Treatment professionals and bereaved families have, for more than a decade now, been warning about the worsening crisis. There are still gaps in the school-based prevention waiting list for treatment slots, insurance company barriers to care, and too few resources designed to support those who do not find the path to recovery. Burr, he added, some good things have happened recently, including more than $25 million in new addiction services funding at a recently passed state budget, but our slow collective response gave heroin a 10-year running head start. Now we are trying to desperately play catch-up. Although knock-on saves are reportedly daily, Reynolds said education is critical. The widespread distribution of naloxone has prevented many overdose fatalities, but too often I'm seeing folks revive, brought to an emergency room only to be discharged within an hour and dead of subsequent overdose within 24 hours later. This is a huge missed opportunity, and we need to make sure that those who are revived are properly counseled, their families are supported, and we help them find a path to treatment and recovery. He added, if we truly want to turn the corner and see the drop in overdose fatalities, we need an all-out, sustained push that involves everyone, schools, cops, healthcare professionals, treatment providers, families, and the entire community. And we will all have to agree one overdose is way too many. Penny Maffetone knows all too well the horror of heroin addiction. She lost her son, Michael, at 29 in 2000 when he overdosed in the family's Laurel bathroom. As a mom to one of 337 heroin deaths in Suffolk County, Long Island, New York, it's the most devastating thing I have ever been through, losing my firstborn son to this horrible epidemic. I'm just glad to see that it is talked about more and more, and since this happened to my son, in the last 4 years has drawn a lot of attention. Maybe more people will reach out for help, and maybe help one another and help another family who have to go through this before they lose a son. I miss Michael more than words can describe. Maffetone's younger son, Paul, found his life forever impacted by his brother's death. He's made it his mission to make a difference, creating a not-for-profit organization, Michael's Hope, in organizing knock-on training session educational forums, as well as speaking at schools to help awareness and save lives. Stories are shared at Michael's Hope meetings about the heroin addiction sometimes begins with opiates found in a parent's medicine cabinet or after an injury requiring prescription for painkillers. The low price of heroin soon makes it a drug of choice, experts say. Of these statistics, Maffetone said, I think it's a scary fact, but it's just that. It's a fact. And we have got to start the conversation and start moving forward before other people lose their son. Michael's Hope co-founder, Vice President, and Director Christina Amato of Comac agreed. The epidemic at its highest peak ever. We don't have time to waste. The time is now. We need to get into the schools, educate about this heroin problem. That's the biggest thing. People are in denial of how serious it really is, and we need to nip it now before more lives are lost. She added that through community events, narcon training, and education, the greater chance we have to save a life. And it has to be done. And as soon as we do revive a person, we need to follow up their care. We can't just merely discharge them and send them packing, because within 24 hours, a lot of them have died. Suffolk County, Long Island, New York, the highest in the state for heroin overdoses. Let's all pull our sleeves up and start working together to save lives together. Let's help people take their lives back. Take care.